Hello, this is Dr. Fonda Goldman, naturopathic physician, and today I was going to discuss Marma therapy or Ayurvedic energy points for breast health, and the information provided here is for both men and women. Note of caution first, information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. As always, it's important to determine the root cause of any disease and to develop a comprehensive treatment plan. Individual cases can vary in terms of treatments that are most effective, and solo therapies may not be appropriate or effective in all cases, so please keep that in mind. A few words about Marma therapy generally. Marma therapy comes from Ayurveda or traditional Indian medicine. It's a therapy that's over 5,000 years old, and it's non-invasive, so it doesn't use needles. And it's an energy therapy. So when you think about energy therapy or paradigms of medicine that are energy-based, in the system, you want to think about people and diseases and states of health as energy waves rather than more of a mechanistic, biomechanical or biochemical type. There are 107 Marma points on the body, and as I mentioned, you have to think in terms of energy waves for this kind of thing. It's quite different. So the touch that's used in these sorts of therapies is very gentle, very soft. There's no pushing, there's no tugging. The more you push, the better result you get. So if you come from a different system of touch, really want to rethink that. There really isn't much that you have to do except basically bring awareness to these points through touch. So for more history on Marma points, check out my first video, Marma points on the hand. If you want a follow along video to kind of have an experience of Marma therapy, I have one that I've created. So this is a follow along for Marma points on the hand, so if that's of interest, check that out. And if you're generally interested in Marma therapy, I have more of this sort of content in my playlists on Marma therapy, Ayurveda, and body care. I'm good at organizing my videos into playlists so that they're easy to find. And if you're just joining us now for the first time and you're interested in learning more of the points, I would start with the Marma points on the hand video, my first one, and then kind of work your way through. So general information or general points about Marma therapy for breast health. So the thing, as I mentioned, these points are beneficial and effective for both men and women, even though especially when we think about breast health, especially in the United States, most people's minds probably immediately go to breast cancer, and specifically breast cancer for women. But actually men get breast cancer too. Not as much as women, not as often or frequently as women, but they do. Actually, I just had a patient who came in a few weeks ago, and her son was diagnosed with breast cancer, and he was in his late 20s, early 30s. So it's possible, so don't overlook that. And these points that I'm talking about today should not be done during surgery, chemotherapy, radiation, active therapies for breast cancer. You should get cleared by a doctor before attempting any of this. And the other thing is that if you have, for example, maybe you're post-treatment for breast cancer, but you still might have something like radiation burns from radiation therapy. I have a number of patients who've had that issue, and it's just the tissue's just sensitive to touch. You can't even wear a shirt. I would consider calendula homeopathic cream. That's worked wonders for my patients who've had radiation burns. So you can apply that first or use that with the Marma therapy potentially to make the skin less sensitive so that you can actually do the Marma therapy. Again, even so, there's not much that you have to do except just gently lay your fingers in the spots, unless you're doing the massage sequence, which I'll talk about later. The other thing is that Marma therapy can be used even if there's alteration of the tissue. For example, if there's been surgery that's done and the skin and tissue is changed, you can still do the Marma therapy, or even if there's pretty heavy scarring, you can use this therapy. So again, I talk about landmarks that you can find your way through the anatomy. So again, that's also what's nice about Marma points, because again, you're working with energy. You're not necessarily working with, sort of mechanistic or physical structures or tissues. There's a link anyway. The other thing is that the sequence should not be performed on anyone except yourself. Again, this is too emotionally invasive for most people, especially depending on their personal background. If they've experienced sexual abuse or assault in the past, or maybe socially, culturally, it's not appropriate. Again, this may trigger people, so only perform the sequence on yourself. And if you end up doing the massage sequence, you can use a mix of flax, corn, and castor oil for a massage. You don't need much castor oil, and castor oil is very thick, so it might be a little tough on fabrics. And but anyway, if you use a mix of these 3 oils, that can be good for breast massage. If you want more information about natural oils and body care generally, I have a whole video on that, so you can check that out. So take care, but again, let's see what we can learn. So I'm going to go through 2 points that I actually covered on in my Marma points for the chest video, because they are relevant in terms of their indications for breast health. But I'm only going to talk about, because I've already covered these 2 points in full in the other video, I'm just going to talk about where they are and the breast indications. If you're interested in other indications for these points, such as lungs, heart, and shoulder, I would see my Marma points on the chest video. So the first one is called Kakshadhara or Skandadhara. These are 2 different names, and it translates into hold to the shoulder and bridge. And the location of this is the deltopectoral groove. So if you kind of roll your shoulder forward, you'll see the sort of line, from the sort of lateral angle of the clavicle, or and moving down. So that whole sort of groove, like if you have a strap for a backpack or something, the backpack strap usually kind of lies right about there, the deltopectoral groove, and it's in the first intercostal space. So it just below, again, the clavicle, that's the first intercostal space, and it's going to be 7 anguli or fingers lateral to the midline of the sternum. Okay, so if you find your sternum, most people can find that, and most people can find the clavicle, and then they can find the deltopectoral groove, so where your backpack straps sit. Okay, so if you just go from the sternum, right, the breastbone, right in the center of the chest, and you slide under the clavicle and get up to that corner there where the shoulder meets, there's a little natural pocket there, and the clavicle meet, that's your point. Okay, so again, I have in my chest video on Marma points, I actually go into more of like the intercostal spaces and how to locate them, so that may be helpful. In any case, so that's where it is, and what is it good for? So things like soreness and fibrocystic changes in the breast, and also a little bit of drainage from this area, especially if the breast gets sore or swollen or congested. So the second set of points, they're called the Hrid points. There's actually 3 of them. Hrid 1, Hrid 2, and Hrid 3. Hrid translates into heart in Sanskrit. And again, these points you should only do on yourself. They're probably too invasive in most cases. And they're located at the 3rd, 4th, and 5th intercostal space. 2 anguli or 2 fingers lateral to the sternum. And again, there's a pair, so there's one on each side, right side and left side of the chest. Okay, so again, if finding these intercostal spaces is challenging, I would go back to my chest video, because I really go through how to find these intercostal spaces. In any case, the breast indications for these points: pain, so from swelling, from tightness, that sort of thing. But again, non-cardiac pain. If you have cardiac pain, again, you should be dealing with a cardiologist and figuring out what that's all about. But congestion and swelling. So we have 4 new points though today for breast health. The first one is called Stanya Mula, which translates to root of the breast in Sanskrit. Stanya means breast, Mula means root. So if you've been watching my other Marma videos, you've heard Mula before, like Manya Mula, the root of the neck, for example, or Angushta Mula, which is the root of the thumb. So yeah, learning a few words of Sanskrit, nice bonus. So the location of this point is it's slightly superior, so closer to the head of the xiphosternal junction. So the xiphoid process is this little, if you look in the diagram here, you can see on the midline of the chest, just below where the heart is, there's like this little, oh, what would you call it? It's a little kind of, almost looks like a little thumb hanging down, straight down the midline. That's a xiphoid process. And so where the xiphoid process meets with the rest of the ribs there, that's the xiphosternal junction. So you want to be 1 anguli or 1 finger lateral to the midline. So you can see the red dot here in the diagram. It's a little bit above the xiphosternal junction, and it's a little bit lateral, about 1 finger lateral to the midline. And again, there's a pair of these on either side of the chest, right and left. And this point also, it's going to be too much for people, so only use this on yourself. The energies balanced by this point are the Udana Vayu, the Vyana Vayu, and the Avalambaka Kapha. So these energies that I've just listed may not mean much to you unless you're a deeper student of Ayurveda. And what they are, just kind of different sort of bodily energies to help categorize the effects of this therapy. So, for example, Vyana Vayu. Vyana Vayu is the sort of circulatory and electrical movement that generates movement of the heart. And so whenever you see Vyana Vayu in Ayurvedic text, it relates to basically the movement and conduction of the heart. So there you go, just one example. But if you're new to this, don't worry about it too much. Just kind of get a understanding where the points are and what they're generally for, and then you can kind of go back later on and add that layer of information as well. So indications, breast pain, tenderness, sensitivity, whether from PMS or menopause, for example, lactation issues, too much, too little, congestion or swelling of the breast, lymphatic circulation, mastitis, cysts and fibrocystic breast. So a lot of breast issues. It does also help with lungs, kind of the outer pleuritic sac. If there's pain, pleuritis, you can use this point to some effect. But again, if there's an infection, you want to do antibiotics as well, whether they're conventional or natural. But Marma therapy by itself, again, you want to use this therapy in conjunction with other therapies as a comprehensive treatment plan. This point also, because it's fairly close to digestive organs, there's some indication here. So if you have nausea or vomiting, this point can be helpful. The point on the right side is related to the liver, and the point on the left side is related to the spleen. So there can be additional benefits besides breast health with this point. The second new point for this today is called Stanya or Chuchuka, which translates as to breast or suck. The location of this point is the center of the nipple. There's a pair, 1 on each side. And again, this point, obviously is too much for most people, so only use this on yourself. The energies balanced by this point are the Prana Vayu, the Vyana Vayu, the Apana Vayu, and the Avalambaka Kapha. Indications, so breast health, lactation issues, but also this point is related to sexual organs, like lower sexual organs, so things like uterine contraction, menstrual labor pain, internal, external genital organs for both men and women, and perhaps surprisingly, it's also related to spirituality and tantric spiritual traditions. this point can be stimulated to help with spiritual or kundalini awakening. So a bit of a surprise perhaps with this point, but helpful for breast health nonetheless. The third new point today is called Stanya Parshva, so this translates the side of the breast. The location of this point is the 7th intercostal space on the mid-axillary line. So the mid-axillary line is if you go right into your armpit and draw a line whoop, straight down the side of your body, that's the mid-axillary line. And there's a pair, again, one on the left side, one on the right side. The energies balanced by this point are the Udana Vayu, the Vyana Vayu, the Ranjaka Pitta, and the Avalambaka Kapha. Indications, again, breast pain, tenderness, sensitivity, PMS, menopause, lactation, congestion, swelling, lymphatic circulation, cysts and fibrocystic changes. So they're basically very similar, if not the same, as Stanya Mula. There's also some help with cardiac and GI congestion. So the point on the right side of the body is related to liver and the right chamber of the heart, and the point on the left side of the body is related to the spleen or the left chamber of the heart. And then number 4, the last new point for consideration in breast health is called Kaksha, which translates as armpit in Sanskrit. The location of this is the apex of the axillary fossa. So if you open up your arm here and you really, you can see the photo here is like you take your finger and go up to the uppermost point there. That's the apex. So the energies balanced by this point are the Vyana Vayu, the Pachaka Pitta, the Avalambaka Kapha, and the Shleshika Kapha. So indications related to breast health are pain, tenderness, swelling, lymphatic drainage, mastitis, abscesses and cysts and fibrocystic changes again. And this point, again, because it's all Marma points have local effects, this is also going to be helpful for upper extremity issues such as circulation of both blood and lymphatic fluid, sweating or excessively, or anhidrosis, not sweating enough, acrid smell. So if there's a acrid smell that you're trying to help, this point can be helpful, but you also want to consider potential things like fungal infection potentially, or your diet, because the things that you eat can affect the way you smell. What else? Lymphadenopathy, so swollen lymph nodes in this area. It helps to relax the shoulder and shoulder pain. Rotator cuff tendonitis can help with this point. Brachial plexopathy, so the large brachial plexus nerve plexus that runs down the side of the neck and through this area to innervate the whole arm and the hand. If there's issues, this point can be helpful. And also things like adhesive capsulitis. So breast benefits as well as upper extremity benefits with this Kaksha point. So I always like to take a few minutes to summarize the points so that we put them in context and create more sort of a framework in which to hang the details. So for the breast points here, again, all Marma points have local effects, and in this video all the points that we've talked about are all good for breast health. To help the upper extremity, Kakshadara from the chest video, and the 4th new point today, Kaksha, are good for the upper extremity, so the 2 that are closest to the arm and the shoulder. Chest, so the Hrid points, because again they're right down the middle of the chest, those are helpful generally for chest pain, non-cardiac chest pain. The lungs are helped by Kakshadara and the Hrid points, and also number 1, Stanya Mula. So basically from the delta pectoral groove down the center of the chest, those points are going to be good for the lungs. And Hrid points and point number 3, Stanya Parshva, those are good for cardiac function. GI 1 and 3, so again the points that are closest to the digestive organs are going to be helpful. Sexual organs, again, point number 2 is going to be helpful there. That's an unusual point on the nipple. Mind and emotions can be helped by the Hrid points. I didn't get into that, but again, I only listed the breast indications for Kakshadara and the Hrid points. So if you want a complete list complete info on these points, I would go back to my Marma points on the chest. And spirituality, again, the unusual point on the nipple, just Stanya is what it's called. So if you look at this photo, I went through the points in the order that you can follow as sort of the path or direction for daily massage. And again, clear this with your doctor to make sure that it's okay for you. But again, if you start up under the clavicle and the delta pectoral groove where your backpack straps tend to sit, and then you're going to go close to the sternum but to the side of it, not straight down the midline of the chest, but just to the side of it and go down, you'll get Hrid 1, 2, and 3. And you kind of go in a little bit to Stanya Mula. You go under the breast to the side of the ribs, 7th intercostal space for Stanya Parshva, and then you go up into the armpit for Kaksha. So you can do this route, this path direction, and do daily massage, again, if it's okayed by your doctor. And you can do 5 circles moving this direction to help with general health, balance, stagnation, circulation of the area, to make sure that the tissue is well supplied with fresh nutrition, oxygenated blood, and to help relieve stagnation, congestion, and toxicity. Okay, so again, 5 circles in this direction along this path on both sides of the chest can be helpful with general breast health and maintenance of health. So there you have it, several points for breast health in both men and women, for new ones, for new points that I haven't discussed in previous videos. Again, there's always going to be some overlap because that's the way our bodies and energetic systems work. But I hope you found this information helpful and useful. And until the next one, take care.